Welcome to our In Focus discussion tonight on National Suicide Prevention Month. Utah consistently ranks in the top 10 states in the U.S. for the highest suicide rates. According to the latest data from the Utah Department of Health, suicide is the #1 cause of death for people between the ages of 10 to 24. Tonight we hear from people who have been impacted by suicide and experts on the reasons and solutions. Kicking off our conversation tonight is Robbie Borders. He is the founder of Smile, You Are Beautiful, and he is someone who has been personally impacted by suicide. Robbie, thank you so much for being here tonight. We're so excited to have you.
Thanks for having me. I really appreciate it.
Robbie, we want to get to know you. Tell us about yourself.
So I was actually born with a disability called ectrodactyly, which gives me missing fingers and toes, and it also impacted my hearing. So that has really impacted me, and it really shows who I am. And then also, I always love to get tattoos to represent who I really am. So I always love to do something like that.
I love that. Now, on a personal level, you yourself have experienced bullying, you've experienced depression. During those dark moments, who or what was it that kept you going through those times?
Through those times, it's been pretty hard. I have friends and families and even animals that really helped me through that. But the one person that really helped me through all that was my neighbor, Mark Eaton, who actually helped me believe in myself and actually keep pushing me to go to push in more of Smile, You Are Beautiful, and actually change the lives of other people.
And it sounds like you're paying it forward. So you are the founder of Smile, You Are Beautiful. Tell us, what is that and what was the idea behind it?
So Smile, You Are Beautiful was created by a friend who passed away to suicide. When I was getting bullied and I first saw him, he sat down with me and says, no matter what you're going through, all you need to do is just smile because you're beautiful. And then a few years later after that, he has passed away to that. And so I thought it would be a good idea to make a difference in what he said to me to help others.
And that has been something that you've coined for the last several years. Last Friday was Suicide Prevention Day. Can you tell us what you ended up doing in Park City on Highway 224?
I was actually got a few of my friends and coworkers to hold a sign that says, Smile, You Are Beautiful, or You Are Loved, You Are Cared For. And we did it from 7 a.m. to about 4 p.m. to let people know that they are actually cared for, they're loved, and they're happy, and that they can come to anybody if they need something.
Now, why do that? I mean, that's 9 hours that you're standing out there in the hot sun. What do you hope comes from that?
To save someone's life. It has really impacted. Every time someone drives by, they're either honking, they're smiling, and they're waving, or they pull over and they say, hey, thank you, you made my day better. So that really is the reason why I keep doing that.
Do you have a favorite memory from all the times that you've gone out, whether it's holding signs or telling people about Smile, You Are Beautiful?
There's actually a few times, there's a lot of memories of that, but I think my favorite one was actually a Summit County police officer coming up to me telling me that I actually dropped our suicide rates up in Park City a couple percentage. And so that was a huge impact on me. I thought it was something that kept me pushing going when I was in high school. And so I thought that was a huge change for me.
How neat. Robbie, you know, how can all of us on an individual level, maybe even the smallest actions, what can we all do to contribute to suicide prevention?
The best way to do it is to have someone to talk to, or actually give out notes or pass it on forward, something that's really small, postcards, which is I do. I send postcards to people that I don't really talk to anymore and make sure that they're doing okay, reaching out, making sure everyone's safe.
You never know when that small little gesture might be the little push or that motivation or that piece of positivity that someone really needed on a really hard day. Yeah. So I absolutely love that. We have some time left for final words. What is your parting message to our viewers tonight, or what do you want them to think about when it comes to suicide prevention?
Well, I really believe that they should definitely make a change in themselves to help other people. There's always the national helpline. If they really need it, they can share that or send it to somebody, or just make sure you're looking out for one of each other, because it's very important.
Well said. You've been hearing from Robbie Borders, founder of Smile, You Are Beautiful. And Robbie, thank you so much for being here tonight. It was a pleasure to have you.
Thank you for having me. Appreciate it.
We'll be right back. Thanks for staying with us for our second In Focus discussion tonight on National Suicide Prevention Month. Up next in our conversation are Taryn Hyatt, Area Director for Utah and Nevada for the American Foundation for Suicide Prevention, and Bené Larson, Prevention by Design Director for the National Alliance on Mental Health Utah. Thank you both for being here tonight. Taryn, we will start with you. Could you begin our conversation with any data or numbers that we know, and what is happening with suicide rates in Utah?
Absolutely. Thank you so much for having this discussion, and hi, Bené.
Hi, Taryn.
So right now, the most current data we have is from 2019, published through the CDC. And that was actually the first time nationwide we'd seen a decrease in the suicide death rate in 2 decades. In Utah, it would have been our 4th year of a decrease. 2019, we haven't finalized yet, but it's looking to be on track with a tiny decrease. However, as we've started to see numbers in 2021, we are starting to see little bits of increases again. So now more than ever, we need to roll up our sleeves and keep our efforts moving forward to prevent this leading cause of death.
Now, Bené, we know there are multiple causes of suicide. Can you discuss some of them with us?
Yeah, you know, there is no one cause of suicide, and we need to be really careful to not blame it on one thing or another. Often it is a lifespan issue, and different, situations that people find themselves in can be the cause of that, whether it's, life issues, things going on in their life, or their mental health. There are so many reasons, and no one issue. So it's really good to make sure that we're checking in on people who may be not being themselves, and we can look to cause hope and be that person who can be the help and the hope that someone needs.
Bené, what are some warning signs then that we can look for in someone who may be contemplating suicide?
Yeah, that's a great question. Often any change in behavior that's out of the norm, maybe they are more withdrawn, or they have stopped doing the things that they love. They may give away prized possessions, increase in drug or alcohol abuse, or maybe they haven't used in the past and they start using. Just some of those things that are out of the ordinary for this individual, or even, that spidey sense, like you have some feeling that something's off. It never hurts to ask and check in on someone and see if they're thinking about suicide.
And we will later in our conversation talk about the importance of language and conversation as well. Taryn, this can be such a difficult situation to navigate. What should we do if someone comes to us and tells us they're thinking about suicide?
The first thing I would say is thank them. Thank them for being willing to share that with you and trust you, and tell them you're here, you'll listen. You want to also be supportive, encourage them to keep talking. What is it that's happening? What changes have taken place? How are you coping with the things that are happening? Ask directly if you're concerned and think that suicide is on the table for them. And this is a great opportunity for us to practice our duck, meaning stay calm, right? Stay calm and reassure them that you're there for them. Follow their lead and see what they feel comfortable sharing, but definitely encourage them that they should seek professional help. Even making the appointment with them or calling with them is a great option to connect them to somebody who can, keep them safe or do an assessment to see where the situation is at.
Now, Bené, on the other hand, what should someone do if they're worried that someone may be contemplating suicide?
Great question. Best thing you can do is ask them, and ask them directly if they're thinking about suicide. And sometimes that's a really hard conversation to have with someone, but it's important to maybe practice it. If there's someone you're thinking about and you're concerned about, practice in front of the mirror. Say it until it feels comfortable to you. But ask them if they're thinking about killing themselves or if they're thinking about suicide, but do it directly so that there's no ambiguity in your question. And if you can't ask them, get them someone who can. Find somebody else who's more comfortable in asking them that question, because you may be the only one that can ask that question for them.
So, Bené, let's talk about the stigma around suicide and how that lack of conversation, there's just some sort of hesitation, right? Some sort of fear that keeps us from normalizing the conversation around suicide, and that impacts efforts for suicide prevention. So could you address this concern that talking about suicide plants the idea of someone who is at risk?
Yeah. You know, that's one of those long-standing myths about suicide, that if you ask, you'll put that into their mind or their head. And, you know, somebody is either thinking about suicide or they're not. If you ask somebody about it, they either are or they're not, but they'll know that you're a safe person that they can talk to and ask for help if they are. We often don't talk about suicide because of that negative stigma associated. We don't want to show that we're weak or that there's something wrong. And that's not the case. You know, asking for help is a sign of strength, not weakness. And we want to make sure that people understand that and that we change this conversation, that it's okay to ask for help.
Taryn, let's get you to chime in. We're on this subject about stigma, right, and conversation around suicide. In your work, what are your thoughts when it comes to the stigma and overcoming barriers and normalizing conversations around suicide?
You know, we have to, Rosie, view suicide as the health issue that it is. If we address it as a health issue, it takes away the stigma, it takes away the shame, the fear. You know, this is something we can do something about, but we need to be honest. We need to let people know where we're at. And the more we're willing to be truthful about what our level of distress is and invite people in, that's how we get rid of the stigma. As Bené said, you know, it's a sign of strength to reach out. It is not a sign of weakness. And if you are contemplating suicide, this is a life-threatening issue, and we need to get you support immediately.
And that's one of the reasons why we invited all of you to come on the show tonight, so that we can continue to have those crucial conversations around this topic. Taryn and Bené, hold that thought. We do have to take a quick commercial break, but when we return, we'll resume our In Focus discussion on National Suicide Prevention Month. Welcome to our third and final In Focus discussion tonight on National Suicide Prevention Month. We resume our conversation now with Taryn Hyatt with the American Foundation for Suicide Prevention and Bené Larson with NAMI Utah. Bené, we'll start with you in this conversation. How crucial is language when we talk about suicide, and what are some examples of how we can all be more conscious or aware of the words that we choose to use?
Such a good question. The words we use can either be helpful or harmful. So often there are negative connotations associated with mental illness and suicide. If you think about, you know, often we hear people say, you know, Sally is schizophrenic, and you know, Sally is more than schizophrenic. Sally's struggling with schizophrenia, and so changing that, the way that we word that, instead saying, you know, same kind of thing with suicide. We often will say, you know, Sally's suicidal. Well, Sally could also be a sister, a mother, a friend. Sally's just struggling with thoughts of suicide, and changing that conversation, or that way we frame suicide, can change, you know, when someone might be more willing to talk about it. Another way is when we say, you know, committed suicide. When I think of the word committed, I think of committing a sin, or I committed a crime. And so taking away that negative connotation can also change how people feel about suicide. So saying something like died by suicide or took their own life, that has a lot less judgment and just states the fact of how they died.
Yeah, those are great tips, and I think that if we can just make those little changes in the language that we use, it will also help break down those barriers and the stigma around talking about suicide. So Taryn, I understand that you've been personally impacted by suicide. As far as an advocate now, what are some tips you have as far as how a person can support a survivor to suicide loss?
Yeah, you know, that's a great one to talk about, because so often, you know, we're avoided not because people don't care, but because they're afraid of what to say and they don't know what to do. You know, treat us the same way you would anyone else who's experienced a loss. You know, come in and sit with us and be with us. don't tell us, how we feel. Keep the cliches for another day. Those are never helpful in the moment when we're told, everything happens for a reason, or, you'll be over this soon. It's not the time to talk about how the loved one died. You don't need to know graphic details of method. That's not appropriate. And it can often be triggering for the person who has just lost that loved one. And my favorite is don't disappear, right? When the funeral's done, when, everybody's gone back home and life has supposedly gone back to normal, that's when we need you. Show up. Call us on our angel day. That's what I call it. We're going to have my dad's 19-year angel day in a few weeks. And that's a day that's tender to me. So I appreciate when people remember that and remember him, help us celebrate birthdays and other things that were fun, just like you would for any other loss. And be patient with us. Sometimes grief is a messy journey. So allow it to be messy and just be there. It's the best thing you can do is just be there.
A lot of great tips there. Benet, I want to squeeze in a question really quick. There's a controversial debate within media and pop culture, movies and whatnot, about the coverage in suicide. I can think of, Netflix shows where they have talked about suicide. As far as media, there's disagreement on whether we should cover cases of suicide. What are your thoughts when it comes to this conversation?
Yeah, it's really a fine line of making sure we're giving safe information about suicide. We understand that the media wants to report on things, but making sure that we aren't glorifying it or making a big deal out of it, not explaining the way that someone died can often, especially, youth are very easily influenced by the things that they see and hear. And so making sure that we're safe in not talking about details, but maybe talking about the pain that they were suffering with and that help is possible. And if you are thinking about suicide, making sure we always have the crisis line available when we report on suicide. And that is a valuable resource.
So let's talk about some of those resources. Taryn, what are some of the resources that are available for someone who is struggling?
One of my favorite resources is sitting there with you in studio, and that's who Benet works for and represents, NAMI. The National Alliance on Mental Illness has a peer-to-peer program where you can talk to somebody who has lived experience and relate. But, it's important that we, again, treat this as the medical issue that it is. See a doctor, see a mental health professional, get an assessment, find out what's going on with your health. While, yes, we may not all have access to a mental health professional right away, you can always call the crisis line and talk with somebody. You do not have to be in a state of suicidal crisis to call. If you're even worried about somebody and you want to know what to do, you could call the Suicide Prevention Lifeline. We also have a warm line answered at the Huntsman Mental Health Institute. So again, these are places where we can talk, where we can get a game plan for what steps we should take next, and then just seek support. While yes, we may have limited resources, they do exist, and often we just need help navigating them.
And Taryn, there is also a new Suicide Prevention Lifeline that's going live in July 2022. What can you tell us about 988 and what can we expect from it?
We've all been waiting for this a long time. And again, this is the brainchild of Dan Thatcher and Steve Ellison here in Utah. And Orrin Hatch and Chris Stewart brought it to fruition at a national level. So 988 will be the new 3-digit crisis line number that will take you directly to the Suicide Prevention Lifeline. So instead of having to call 911 when we're having a mental health crisis, we'll be able to call and get a mental health response to somebody who's in crisis with their mental health. So it'll go live in 2022. There's still funding issues and things we need to secure and make sure are in place, because we want to have adequate staffing and funding available for this resource when it goes live in July of 22.
And hopefully one day 988 will become as normal and just second nature as 911. Now, Benet, before we wrap up the discussion, can you tell us about NAMI Utah's annual mental health conference?
Yes, we're really excited. It's coming up on September 30th, and it will be online this year. And you can go to namiut.org and register. It's really inexpensive. We also have scholarships that are available for anyone who's interested. We've got great presentations on mental health and suicide prevention. So please check out namiut.org. And we also have lots of great resources, like Taryn said. We have mentors that are available to speak at during the day, and they have struggled with mental health issues themselves or with a family member, and they can walk you through the process of getting the help you need.
Renee, we have time for final thoughts. What would you like to leave our viewers with tonight, or what do you want them to think about when it comes to suicide prevention?
Suicide is preventable, and if you're struggling or considering, please hang on. Hope is possible, and I think that if we offer them hope that whatever it is you're going through, you can get through, just ask for help, and it's okay. It's okay to verbalize it and ask for help, because help shows that asking for help shows that you are strong and that you want to continue and live. So thank you for having this conversation today.
We are honored to be a part of it. You've been hearing from Taryn Hyatt, Area Director for Utah and Nevada for the American Foundation for Suicide Prevention, and Renee Larson, Prevention by Design Director for the National Alliance on Mental Health Utah. Thank you both so much for being a part of this crucial conversation with us tonight.
Thank you.
Thank you.
And don't forget, we'd love to hear from you about the show. We invite you to join our Facebook group by searching for ABC4 In Focus, or send us an email, infocus@abc4.com.